This project will cover Chapter 4, which is using simulation to teach nurses. The following items will be covered in the project, starting with the emergence of high-fidelity patient simulators, and the capabilities of patient simulators, simulation and healthcare quality, the benefits and disadvantages of simulation, simulation for practice settings, research on simulation outcomes, regulatory trends, recognize the value of simulation, simulation and continuing education for nurses, developing a simulation center, and we'll end with a conclusion. So let's begin with what simulation is and how it can be used to teach nurses. So simulation to teach nurses is done with a computerized mannequin that is programmed to respond in realistic ways. The mannequins are programmed by an instructor to display various signs and symptoms. The mannequins can be set so that the nursing student can listen to heart sounds, lung sounds, bowel sounds. The student can also feel for pulses on the mannequin and see respirations and pupil responses. ECG, blood pressure, hemodynamics, pulse oximetry, and temperature are usually attached to the patient and are seen on a monitor, just as they would be attached in a hospital room. Within the last decade, there has been an increase in the amount of these high-fidelity patient simulators. They were used in the 1980s to train anesthesiologists and military personnel, but because of costs, they weren't used in nursing schools. Now that the costs have decreased and these simulation rooms are cheaper to create, they are now being used in various nursing schools all over the world. So let's talk about the benefits and disadvantages of simulation. Starting with the benefits, they provide realistic skill practice. This is kind of the number one reason to even use simulation. Other benefits are that the instructor can observe every step that the student makes during a simulation and then provide positive criticism. Simulation can expose students to rare events that they don't commonly see. Some examples are emergency situations and end-of-life situations. The level of difficulty in simulation can be adapted, so they can teach the novice nurse or they can teach the expert nurse. Simulation can be designed for team practice, which enhances collaboration and improves team communication skills. It can also provide for practice with working with interdisciplinary members. Disadvantages of simulators are cost. So initial cost of these simulators can cost between $40,000 to $90,000, and they also only have an expected shelf life of around 3 years. Some other disadvantages are that the number of students who can work with a simulator at a time is limited. Another big disadvantage is the need for faculty involvement and time management. Students may also feel like they are put on the spot and experience anxiety, especially when they're being observed by their peers and faculty. Another disadvantage is that students might not function as if the scenario was real, which would limit learning altogether. Because there are a lot of advantages to simulation to teach nurses, it's important to know how to create an effective simulation lab. So some tips that the book mentioned are, tips for effective teaching through simulation are to provide feedback during the learning experience with the simulator, ensure that learners repetitively practice skills on the simulator, integrate simulators into the overall curriculum, ensure that learners practice with increasing level of difficulty, adapt the simulator to complement multiple learning strategies, ensure that the simulator provides for clinical variation, ensure that learning on the simulator occurs in a controlled environment, provide individual learning on the simulator, clearly define outcomes and benchmarks for the learner to achieve by using the simulator, ensure that the simulator is a valid learning tool. Simulation can be used in various settings. So not only is it for academic settings for training nursing students, but it can be used to test new procedures before bringing them to the patient bedside. It can also be used to orient nurses into critical care units. It can be used to increase communication in an operating room setting, and more importantly, it can be used for continuing education. Nursing student perceptions of simulation. So in general, studies show that students are very satisfied with simulation as a method to learn. The book mentioned a few studies. The first one mentioned that students stated that they were able to sharpen their leadership skills, improve teamwork, and practice effective communication as a part of the simulation experience. Students reported that they believed their real ICU patients were safer because they learned how to deal with similar situations in simulation. Another study compared two groups of first-year nursing students to examine the effects of using the human patient simulator prior to the first clinical experience. One group of students worked with a simulator 1 week before the clinical experience. The other group experienced the traditional skills lab. The study concluded that the intervention group experienced less anxiety and greater comfort in their first clinical experience. The simulator group believed that the experience gave them confidence in their assessment skills, helped to relieve stress on the first clinical day, and should be a component of the nursing curriculum. Regulatory trends recognize the value of simulation. The Accreditation Council for Graduate Medical Education and the American Board of Medical Specialists both have embraced simulation as a tool that can assist in determining practitioner competency. The National Council of State Board of Nursing has also embraced the simulation as a tool. They have been looking into a 3-part performance assessment for registered nurses. So this 3-part would include an exam, which would be given in the last year of nursing school, followed by the exam for licensure, which is our NCLEX, and a 3rd exam after the first year of work. And they're stating that simulation would be a huge method to assess the skills of the registered nurses. So this is both intimidating and exciting. In conclusion, simulation will continue to play a significant part in teaching nurses. Whether simulation is used to teach nursing students, new graduates, people orienting to new role or specialty, or for continuing education, I believe simulation will continue to make a great difference in how nurses are taught and are continued to be taught.